Gentlemen, I am Dr. Anya, and today I am breaking a silence that has lasted decades. If you are a man over 50, and you practice sexual self-pleasure, I need to ask you something you have probably only ever asked yourself in the dark, alone, without anyone to answer you honestly. Is this actually hurting me? Or is it something my body genuinely needs? Your doctor never told you. Your father never told you. The culture around you spent 50 years sending you mixed signals, guilt on one side, crude jokes on the other, and the actual clinical science got buried underneath all of it. So today, I am giving you the science. I have reviewed the latest peer-reviewed research and I am breaking it down into 8 specific clinical benefits that could change how you think about your own longevity, and 4 serious medical warnings that most men over 50 are ignoring right now, at real risk to their health. Stay with me. This is the conversation your doctor owed you. Clinical insight number 1. The prostate flush. Your prostate is, biologically speaking, a filtration system. And like every filtration system in medicine, your kidneys, your lymphatic vessels, your bile ducts, it depends on regular flow to stay healthy. When that flow stops, the ducts accumulate something. Crystalline deposits. Inflammatory byproducts. Secretions that, left stagnant, create exactly the kind of cellular environment where malignancy develops. A landmark study published in the journal European Urology followed nearly 30,000 men and found that those who ejaculated 21 or more times per month had a significantly lower incidence of prostate cancer compared to men ejaculating 4 to 7 times monthly. This is not coincidence. This is filtration biology. Regular ejaculation is not indulgence. For the aging prostate, it is maintenance. If that fact surprised you, and I suspect it did, hit subscribe right now, because we are only getting started. Clinical insight number 2. The pelvic floor workout you never knew you were doing during orgasm. The muscles of the male pelvic floor, the levator ani, bulbocavernosus, ischiocavernosus, contract rhythmically. Anywhere from 30 to 40 involuntary contractions per event. For most men over 50 who are not doing targeted pelvic floor exercises, and most are not, this may be the only meaningful, regular contraction these muscles receive. Why does that matter? Because weak pelvic floor muscles in older men are directly linked to urinary incontinence, reduced erectile quality, and a painful condition called pelvic congestion syndrome. You are not just experiencing pleasure. You are doing involuntary physiotherapy on one of the most functionally important muscle groups in the aging male body. Clinical insight number 3. The cortisol shutdown. Cortisol, your primary stress hormone, is one of the most destructive forces operating in the body of a man over 50. Chronically elevated cortisol suppresses testosterone, disrupts sleep, accelerates vascular aging, and blunts immune response. Here is the biology. At the moment of orgasm, your body releases a surge of oxytocin and prolactin. These 2 hormones directly downregulate the hypothalamic pituitary adrenal axis, the system that produces cortisol. In plain language, orgasm tells your stress system to stand down. For men carrying the accumulated cortisol load of career pressure, financial anxiety, and the chronic low-grade fear that comes with aging, this is not a small thing. This is measurable, mechanism-level stress relief. Clinical insight number 4. The brain activation protocol. Sexual arousal does not happen below the waist. It happens, first and most importantly, in the brain. Coordinated activation across the prefrontal cortex, limbic system, hypothalamus, and cerebellum. Simultaneous engagement of dopamine, serotonin, oxytocin, and norepinephrine pathways. Researchers studying neuroplasticity and cognitive aging have identified exactly this kind of multi-region, multi-neurotransmitter activation as protective against cognitive decline. The same dopamine pathways stimulated during sexual activity are the ones that, when chronically understimulated, correlate with depression and cognitive blunting in older men. You are not just maintaining physical health. You are exercising your brain. Clinical insight number 5, the sleep protocol. Raise your hand, metaphorically, if sleep has gotten harder after 50. If you lie awake at 2 in the morning when you never used to. If you fall asleep fine but wake up wired and cannot return. The prolactin surge following orgasm has a clinically documented sedative effect. It promotes slow-wave sleep and reduces the cortisol-driven hyperarousal that fragments sleep architecture in older men. This is not anecdotal. It is endocrinology. And for men who have tried melatonin, magnesium, sleep hygiene protocols, and still struggle, this is a mechanism worth understanding. Clinical insight number 6, the vascular use-it-or-lose-it principle. One of the least discussed realities of male sexual aging is this: tissue that is not regularly engorged with blood loses elasticity, oxygenation, and functional responsiveness over time. Regular arousal drives increased circulation through penile tissue, pelvic floor musculature, and the prostate itself. For men over 50, where vascular health in this region declines without consistent stimulation, this circulation is not optional. It is the mechanism by which tissue stays functional. The myth was that this practice depletes you. The biology says the opposite. Disuse depletes you. Clinical insight number 7, the testosterone signal. Here is something counterintuitive. Short-term abstinence, 3 to 7 days, produces a measurable, temporary spike in circulating testosterone. Some men over 50 use this deliberately, as a kind of hormonal reset. But the key word is temporary. Chronic long-term abstinence does not sustain elevated testosterone. It correlates with declining testicular sensitivity to luteinizing hormone and, over time, with reduced baseline testosterone production. The research here points to a balance point, regular but not compulsive practice, as the physiological sweet spot for hormonal health in the aging male. Clinical insight number 8, the self-examination window. This one is rarely discussed, and it represents a genuine gap in male preventive health. Regular self-practice creates a consistent opportunity for self-examination. You become familiar with your own baseline, the texture, sensitivity, and structural characteristics of your own tissue. Deviations become detectable: lumps, lesions, abnormal discharge, changes in ejaculatory force or color. In a population where testicular and penile pathologies are routinely detected late because men do not self-examine, this matters. Self-knowledge is the foundation of early detection. And early detection saves lives. Now, I want to pause here, because I know men from many different countries watch these conversations, and I want you to know, you are not watching this alone. Drop your country in the comments. This conversation is for all of you. But I promised you warnings. And I meant it. Because conscious practice requires knowing the risks just as clearly as the benefits. So here are the 4 medical traps most men over 50 are walking into without realizing it. Warning number 1, friction trauma and Peyronie's disease. Skin over the penile shaft in older men is thinner, less elastic, and repairs more slowly than it did at 30. Micro tears from excessive pressure or prolonged sessions, without adequate lubrication, accumulate over time. The result can be localized scar tissue formation, fibrous plaques that alter erection angle and cause significant pain. This condition is called Peyronie's disease, and its incidence rises sharply after 50. The fix is simple: use lubrication every time, reduce grip pressure, keep sessions to a reasonable duration. This is not restriction. This is tissue care. Warning number 2, nerve desensitization. Repeated high-intensity stimulation, particularly through devices or techniques that no natural partner could replicate, progressively raises the threshold required to trigger arousal and orgasm. The clinical consequence is not merely reduced solo satisfaction. It is reduced partnered intimacy, and eventually, functional erectile difficulty during sex with another person. Variation and periodic return to baseline sensitivity are not limitations on your pleasure. They are protection of it. Warning number 3, emotional escapism. This is the warning most likely to go unaddressed, because it requires the most honesty. For men navigating grief, relational disconnection, loneliness, or depression, all of which become statistically more common after 50, sexual self-practice can quietly shift from genuine desire to avoidance. Not clinical addiction for most men, but a substitute for the emotional engagement or professional help they actually need. If the frequency is rising during periods of emotional difficulty rather than physical desire, that pattern deserves curiosity, not shame, and possibly a different kind of support. Warning number 4, masking vascular warning signs: changes in erectile quality, reduced sensitivity, or shifts in ejaculatory force are often early vascular or neurological signals, potential harbingers of cardiovascular disease, diabetes, or hormonal decline. If regular self-practice reliably compensates for these changes without you ever noticing them, you may be delaying a clinical conversation that could be life-saving. If something has changed in the last year, that change belongs in a conversation with your physician. This is not a reason for shame. It is a reason to pay attention. Here's what I want you to leave this conversation carrying. Not guilt. Not recklessness. Precision. Consciousness. Self-respect. Lubricate well. Avoid compulsive escalation. Treat this practice as one component of a genuine commitment to vascular, hormonal, pelvic, and neurological health, not as something hidden from that commitment. Your body at 50, 60, 70 is still responsive. Still capable of repair, of function, of vitality. But it requires you to be an informed participant in that process, not a passive, silent one. You deserved this conversation a long time ago. Now you have it. Share it with someone who needed it too, and subscribe, because the honest medical conversations continue.